Well, the death certificate of a woman who died in Richland County says her cause of death is due to complications from COVID-19. However, her family says she never had the virus, that she was never even tested. Now they're turning to WIS to find out how and why this happened, why the hospice doctor signed off on the death certificate, and whether her death was included in DHEC's daily totals. Our Caroline Colburn has been working hard on this story over the last couple of days. Caroline, I know you have talked to the coroner, you have reached out to DHEC, and you've really pressed this hospice facility to figure out how this happened. What have you learned?
Well, Judy, 79-year-old Joan Hill was never inside of a hospital or medical facility over the past 7 months. She lived with her daughter at her home in Richland County, who cared for her until she died. Now, her family says they know COVID-19 is real and it's affected millions of people worldwide, but they say it didn't affect her.
My grandmother was an amazing woman. She was a homemaker, housewife, basically, like her pretty much whole life.
Joan Hill dedicated her life to her family.
We were very close.
The beloved mother and grandmother suffered from dementia for several years and passed away in her daughter's home in Richland County on July 31st.
This has definitely been a hard loss.
Last week, an already tough time for granddaughter Kimberly Klosterman and her family got even more difficult when they received Hill's death certificate.
It's just wrong.
It lists Alzheimer's disease and COVID-19 complications as her cause of death.
To have a report come back and say that that's what my grandmother passed away from when she was never even tested, had no symptoms, it's devastating.
Klosterman says her whole family was tested for the virus a few weeks prior, and they all received negative results.
We asked hospice to test her then, and they said that there was no need to test her if there were no symptoms, and she never showed any symptoms whatsoever.
Hill was being cared for by Amedisys Hospice in West Columbia, which sent nurses to the home regularly to check on her and reported her death to Richland County Coroner Gary Watts.
When you contacted me was the first time that we were made aware of that was anything listed as far as COVID. When we took the call originally, it was a patient with Alzheimer's. Nothing was mentioned about COVID-19 at that time.
Watts explained he isn't required to sign off on a death certificate of someone in hospice care. That was done by an Amedisys doctor.
It's certainly some things that need to be answered as to why that happened and who made that decision, and why that decision was made. If there was no indication of that at the time of death, then I think the family deserves an answer. I think all of us deserve an answer.
We asked Amedisys why COVID-19 was listed on Mrs. Hill's death certificate, and we received a statement saying due to patient privacy, they cannot comment on this situation, but that they acted in accordance with the coroner's office and followed clinical protocols.
It needs to be taken off.
We also asked DHEC if Mrs. Hill's death was listed in their daily totals, but the agency says it cannot comment in detail on individuals' deaths or cases due to privacy restrictions. But they did point out DHEC does not have a role in determining a cause of death.
Well, it's terrible, and it makes you not be able to trust the numbers that is being reported.
This grieving family wants answers, but most of all, they want to make sure their grandmother isn't listed as a South Carolina COVID-19 death. Now, another important factor in this case is that Mrs. Hill's body was transported directly from her daughter's home in Richland County to the funeral home. We also received confirmation this afternoon that there was not a COVID-19 test performed on Mrs. Hill after she died.
Now, Caroline, as you just pointed out, DHEC has no role in determining the cause of death, and they can't answer, due to privacy concerns, questions about this specific case. However, we do have the guidance regarding the CDC definitions of confirmed cases and probable cases. Could Mrs. Hill's death have been counted in our list of probable cases?
Well, Judy, it's very likely that it could be. Now, based on DHEC's definitions of a confirmed COVID-19 death, that means someone would have had to have one of the viral tests done and would have had to receive that positive test result. But for the presumptive death cases that we have heard about, that means that someone's death certificate has listed COVID-19 complications, but they did not receive that viral test. So again, this begs the question of what symptoms of COVID-19 might be necessary for a doctor to list COVID-19 complications on a death certificate.
All right, our Caroline Colburn, excellent work on this investigation. We should also point out Caroline has reached out to the doctor that signed this death certificate. We have not been able to do an interview with that doctor, but this is a case we will certainly continue to follow. Caroline, thank you once again. For our viewers, we know you have a lot of questions, and we want you to know that WYS takes every allegation regarding the number of COVID cases and the accuracy of the data very seriously. We have looked into every case when someone has called us with a similar allegation, and this is the first time that we've been able to confirm any sort of discrepancy of this type in these cases. We certainly will make sure that we continue to follow this story and let you know of any new information as we're able to confirm it.